Well, I mean, I think ultimately we will have to determine the promise of some of the targeted therapies that are emerging in early phase trials, including the FLT3 inhibitor class, the menin inhibitor class that I just mentioned. But also, antibody drug conjugates, antibody radiation conjugates. There was a presentation at this year's ASH meeting looking at specifically lintuzumab AC225. This is an antibody radiation conjugate. And they showed some interesting findings, specifically also in patients with high-risk disease, such as P53 mutations. I think we need more experience with this class of drug, but there is some interesting findings specifically related to antibody drug conjugates as well. Again, my good friend, Dr. Dauber from MD Anderson, presented some data with a CD123 antibody drug conjugate in combination with HMA therapy that seems to be quite promising. Well, I think most of this data is still very early stage. And I think, again, we're seeing some signals of activity with, sort of an impressive percentage of a small number of patients responding. Ultimately, we will have to have larger data sets to peruse and understand whether the activity is real and feasible. Potentially can help patients with relapse refractory disease or newly diagnosed AML. There are subtypes of AML that remain challenging, such as patients who have preceding marrow malignancies, complex karyotypes, P53 mutations. Those are the patient populations that we need to see some improvements in. And as I mentioned, the antibody drug conjugates, such as the drug from ImmunoGen, as well as, I forgot to mention, the magrolimab, obviously the CD47 naked antibody. Those in combination with hypomethylating therapy seem to potentially have some promise.